Now, before taking the patient's blood pressure, you're gonna ask them what?
Do you have a history of high blood pressure?
Now, the question is, why do you ask if you have a history of high blood pressure? Now, a normal blood pressure for average adult is who?
120 over 80.
120 over 80. The top number represents who?
Systolic.
Systolic. The bottom number represents what?
Diastolic.
So if the normal blood pressure for average adult is 120, do I have a history of high blood pressure? Yes. Bam. I have a history of high blood pressure. Your next statement to me, where does your top number rest? Because remember, it's higher than 120 because I'm not average, right? So my blood pressure top number is 132. Bam, that's a good number. 132 over 98. So if my blood pressure is 132, my top number, my systolic number, you're going to increase the blood pressure. Increase the blood pressure dial. You're not going to stop at 132 because I said that's my resting. That's where it starts. You have to go higher. What number do you think you're going to go higher if you're taking a look at your blood pressure page? If you take a look at your blood pressure page, where do you think I'm going to click it high? Inflate it higher to? 140? Okay. What do you think? You say about 140? So I'm going to inflate the blood pressure cuff all the way up to 140. What do you think I should inflate it to?
140 also.
140 also? Bam. That would be accurate. So by the time you deflate it, and it starts getting to my target, 132, you should start hearing it first. Does that make sense?
Oh, okay.
So now I don't have a history of high blood pressure. Now what are you going to do? How far are you going to inflate the blood pressure cuff if I don't have a history of high blood pressure?
120.
If you deflate it to 120, by the time if you inflate it to 120, by the time you start releasing the dial,
130.
you're going to automatically start hearing it. So always go 10
130.
10 to 20 above the average number. So we'll say 130. You're going to inflate the blood pressure cuff to 130. So by the time you get to 120, you should hear your first. That's the purpose of asking if a patient has a history of high blood pressure. If they say no, inflate it to 130. If they say yes, where does your top number rest? If that makes sense.
You go based off of their top number, so that specific person's top number in that moment, correct?
Exactly, in that moment, or their history. Now, what is the abbreviation for history?
HX.
HX. How was it written?
Capital H, lowercase x.
Capital H, lowercase x. Yes, they have a history of high blood pressure. I said 132. Did I say 132 over 98? Which arm did we take my blood pressure on? My dominant is my right, okay? Whenever you document it, you're going to say 132 over 98R with a circle around it. You took my blood pressure on my right arm. Why do you think it's important to document which arm you took the blood pressure on?
That can be different.
It could be different if the provider say, I don't like that number, go ahead and retake it. Now you took my blood pressure again. Is 128 over 88. Bam. 128 over 88. But you took it on my left arm now. Does that make sense? So that's the purpose of documenting which arm. Just like when we give injections, we have to document which arm we gave that injection on. So the first question you're going to ask your patient before taking their blood pressure is what?
If they have any history of high blood pressure.
If you have a history of high blood pressure. If they say yes, 142, how far are you going to inflate the blood pressure cuff?
150.
150 or 160, right? The top number is called who? The bottom number is called who?
Diastolic.
Bam. And another statement you need to make to your patient, feet flat on the floor. If they're sitting in the chair. Because their ankles cannot be crossed.
What was the reason for that again?
Because you need an even blood flow.
Okay.
You need an even blood flow. Bam.